Hello and welcome to today's video. Today we're going to discuss about mouth piercings, a latest fashion trend that can affect your oral health. So make sure you watch this video right till the end before you get any mouth piercing done. Mouth piercings are becoming increasingly common these days, and they include piercings of the tongue, cheek, lips, gums, etc. So before getting a piercing, it's good to know all the effects that it can have on your oral health. So let's look at the effects of piercings on your oral health. Number one is gum recession. Due to the constant irritation from the piercing, your gums may recede. That means your teeth will appear longer and your gums will shrink. This exposes more amount of the root surface of the tooth, hence making the teeth sensitive. Now it's important to note that it's not possible for receding gums to grow back to normal. Almost 50% of those with lip and tongue piercings experience gum recession at some point in their life. Number two is tooth loss. Now there are loads of bacteria in the mouth, and oral piercings can harbor harmful bacteria. So this puts you at a higher risk for developing gum disease. And if you've already got recession due to oral piercings, then you're at a higher risk for developing periodontitis or advanced gum disease. Now this eventually leads to tooth movement or tooth loss. Number three is crack fillings or cracked teeth. It's quite common for the metal piercing to hit against your tooth structure, and this can leave you with cracks or chipped teeth, and very often even dental fillings can chip or break away. Number four is infections or abscesses. So if you do not keep the area clean, or if the oral piercing is not cleaned on a regular basis, then you could end up with abscesses or infections which would need antibiotic treatment. Number five is diseases such as hepatitis, tetanus, herpes, etc. All this is dependent on where you decide to get the piercing done. So if proper infection control measures are not in place where the piercing is done, then you're at a higher risk for developing such diseases. Number six is bad breath, which is another very common issue with oral piercings. Now, because these piercings can harbor bacteria, bacterial products can lead to bad breath. Number seven is difficulty during dental appointments. Now, if your dentist needs to take x-rays or needs to perform certain procedures in the mouth, such as taking impressions, then it can be very difficult for the dentist as well as for you for the procedure to be carried out. So make sure when you're going for dental appointments to remove all oral piercings, so it's easier for you as well as the dentist. Number eight is allergic reactions. Now, some people, due to hypersensitivity to metal, can develop severe allergic reaction that can be seen as a rash on the cheek or on the lip area, and sometimes you could also have breathing difficulties because of this. Number nine is excessive drooling due to increased saliva production. Now, because of the location of piercings, in some people it is noted that there is excessive saliva production when there's a piercing in the mouth. Number 10 is ingestion. Now, sometimes people tend to swallow their piercings, especially if it is the magnetic ones, or sometimes it can even go into your lung if it goes down the wrong way. So it's advisable not to use magnetic studs or magnetic piercings. British Oral Health Foundation and American Dental Association advise against all types of oral piercings. Now, it's advisable to stay clear even from the fake ones or the magnetic ones, as there's high risk of ingestion. So we've looked at all the effects of oral piercings on health, and it's best to keep away from them. But what can you do if there's existing mouth jewelry? Number one, keep the area clean, and this will help keep infections at bay. Number two is remove jewelry periodically and clean it. You can soak your jewelry in cleaning solutions to keep it nice and clean. Number three is avoid playing with the piercing. Even though there's a high temptation to do it, when the piercing is in the mouth, avoid playing with it, as this can crack your teeth or cause chips and wear of your fillings. Number four is make sure you remove all kind of oral jewelry before playing any sport. Number 5, if you really have to choose a tongue bar, then it's better to choose a shorter one than a longer tongue bar, because this does not hit your teeth as much as the longer ones. Number 6 is plastic jewelry is slightly better off than metal because it causes lesser damage. Hope you found this video useful. Do subscribe for more such videos and see you soon in the next video.